So friends, let us start the second session on COVID-19 prevention. So this session is all about the steps and measures to be taken for preventing COVID-19 disease. So let us see one by one the steps to prevent COVID-19 spread. First of all, we all must stop shaking our hands or hugging also. We must greet each other from a safe distance. We should adopt some other methods for greeting each other instead of shaking hands or hugging each other. So this is the first step. The next is strictly observe social distancing. For that, you have to stay at least 6 feet away from others whenever possible. You must keep a distance of 6 feet from other person. The next step to prevent COVID-19 spread is wearing a mask properly. So you should cover your mouth and nose with a mask when around others. Here you can see the right way to put on a mask on your face. You should wear mask like this one. You should cover your nose as well as mouth properly by the mask. This is the right way, and you should not keep your mask like this by keeping it near your chin or below your nose so that your nose is exposed here. So in this way, you could not be kept away from the virus. So this is the wrong way and this is the right way. So you have to put your mask properly so as to cover your mouth and nose in a proper manner. The next step is wash your hands often with soap and clean water for at least 20 seconds. This is very important and we will discuss it further. And now the next step is don't touch your mouth, nose or eyes. And if unavoidable, touch such areas only after hand washing properly or sanitizing your hand with a good quality hand sanitizer. You must also cover your cough or sneeze with a tissue and then throw it in the trash. If tissue paper is not available, you should cough or sneeze in your elbows. Also routinely clean and disinfect frequently all the touched surfaces or objects. The surfaces that you touch or the objects, they must be cleaned and disinfected properly and frequently. There are many more steps to prevent COVID-19. Let us see what are the next. Stay home as much as possible. You should try to keep yourself at home instead of roaming outside. Avoid crowded indoor spaces also. Even if you are at home or in your workplace, in indoor spaces, if necessary, then avoid crowded indoor spaces and isolate from others if you are sick. If you have any kind of symptoms, then isolate yourself from others and ensure that indoor spaces are properly ventilated. General health maintenance is very important, particularly at this time. Therefore, you should quit smoking, do exercise, and take nutritious food so as to maintain your immunity level as well as good health to combat the disease. You must be informed and prepared. Do not believe on rumors regarding COVID-19 disease. How there are so many rumors regarding COVID-19 and coronaviruses on various media. So do not believe all of those things, only believe on reliable sources. Contact a medical practitioner or health worker if you have symptoms and follow instructions for test and care. The next step to prevent is ensure periodic sanitization of the areas where you live or where you work. So proper sanitization sanitization by using sprays or disinfectants like sodium hypochlorite solution, etc., is very important. Also use PPE kit if there is high possibility of catching coronavirus infection. This is especially for high risk workers like medical staff. And the best way to prevent COVID-19 is to avoid being exposed to this virus. So try your best to avoid being exposed to this virus by staying at home, avoiding crowded indoor spaces, isolate yourself from others so that you are away from the coronavirus, which is the root cause of this disease. So as we have seen, hand washing is very important. So let us see, when do you need to wash your hands? So hand washing at least 3 times a day is very important, but even more important after returning from a public outing, for example, grocery store, when you return from work or a school or from a concert or a sporting activity or from your hospital or nursing home. After returning, you must wash your hands. Also wash your hand before leaving the bathroom, both at home and in public bathrooms. Before, during, and after preparing food, especially raw food. Before eating food. Number 5, before and after caring for someone at home who is sick with symptoms. Number 6, wash your hands after blowing your nose or coughing or sneezing. Also wash after using public computers, touching public tables and countertops, cash, currency, and coins, or other people's phone, etc. Wash your hand after touching an animal, particularly pet, animal feed, or animal waste. Also after handling pet food or pet treats. Also wash your hands after touching waste bin or garbage and after putting on your shoes. And most importantly, before touching your mouth, eyes, or nose, always sanitize your hands. Make it a habit to properly wash your hands with soap and water or sanitize it with a good quality sanitizer before touching your mouth, eyes, or nose. This is very, very important, and you should make it a habit for yourself so as to prevent catching COVID-19 disease. So continuing with the steps to prevent COVID-19 spread, let us see how to wash your hands. Here you can see several steps for washing your hands. First of all, wet your hands with water. Then apply soap generously on your palm. Rub hands or palms to palm. Then rub the back of each hand with fingers interlaced. Then rub palms together with finger interlaced. Then rub with back of fingers to the opposing palms. Then rub each thumb clasped in opposite hands. Also rub the tips of your fingers. Rub each wrist with different hands from one hand to another wrist. And then finally rinse with clean water, under running water. And then properly dry it thoroughly, your hands, and your hands are now clean. So these are the steps. We can also understand the demonstration of hand washing through an interesting video. Let us see this video.
Hand washing with soap and water in 12 steps. Step 1. Wet hands. Step 2. Apply soap. Step 3. Rub hands palm to palm. Step 4. Rub back of hands. Step 5. Rub palms with interlaced fingers. Step 6. Rub back of fingers with fingers interlocked. Step 7. Rub each thumb. Step 8. Rub tips of fingers in a circular motion. Step 9. Rub wrists. Step 10. Rinse hands. Step 11. Turn off tap with elbow. Step 12. Dry hands with disposable towels. Following these 12 steps for effective hand washing should take around 30 seconds.
So friends, I hope you must have seen all the steps in this video on how to hand wash your hands properly. In this video, you must have seen altogether 12 steps for washing your hands. Now let us simplify it and see the key 5 steps of effective hand washing. The first step is wetting your hands. Put your hands under clean running water, then apply soap. The third step is scrub your hands for 20 seconds. The scrubbing process we have seen in the video. We have seen how to scrub your hands properly, your fingers, your palms and your wrists and all the parts of your hands. Then the fourth step is rinse your hands well. Return both hands to the running water and gently wash away the soap. And the last step is drying your hands properly. That is, you must completely dry the water from your hands using a disposable towel, preferably, or a common hand towel, and you should dry it properly. So this is the summary of washing your hands properly so as to effectively make your hand washing effective to prevent corona spread. Now let us see how to choose a right face mask, because using a face mask is very important for coronavirus prevention and for preventing the disease caused by coronavirus. So here you can see that you must choose the masks that have 2 or more layers of washable and breathable fabric. So your mask should be made of at least 2 layers. Preferably it should be of 3 layers, but at least it should have 2 layers. Also, your mask should completely cover your nose and mouth, and it must fit snugly against the sides of your face and don't have any gaps from the sides so that outside air or infection could reach to your mouth or nose. So you have to choose a mask so that it properly fits on your nose and mouth. It is tightly on your nose and mouth, and it should be of at least 2 fabric layers. You should not choose a mask that are made of fabric that makes it hard to breathe. For example, mask made of vinyl, which makes breathing very difficult. So you should not use such masks. Don't use masks which uses exhalation valves or vents, which allows virus particles to escape from it. Some masks have valves. These are not good for you. Also, don't choose masks that are intended for healthcare workers, including N95 respirators or surgical masks. N95 respirators basically are used by medical staff, and they should not be worn as daily practice. They are only for risky environment. So in daily practice, you should choose a mask that have 2 or more layers of washable, breathable fabric, and it fits properly on your nose or mouth, and it should not have any gap from the sides. So this is the way of choosing a right face mask. Now let us see how to take off and cleaning a face mask. So here you can see, first of all, carefully untie the strings behind your head or stretch the ear loops. Then handle only by the ear loops or ties on the side of the mask. Then fold the outside corners together. And the fourth step is be careful not to touch your eyes, nose, and mouth when removing the mask, and wash your hands immediately after removing the mask. So this is the right way to take off a mask. And let us see how to clean a mask. So except single-use disposable masks, you must wash all used face masks regularly. Include your mask with your regular laundry, use regular laundry detergent, and the warmest appropriate water setting for the cloth used to make the mask. For example, it is made from cotton, then keep the water temperature level at the highest for the cotton fabric. Also use the highest heat setting and leave in the dryer until your mask is completely dry. You can also wash your mask by hand. In a bucket also you can wash using detergent, powder or soap and clean water. And after washing with hands, you must dry it properly under sunlight so that there is no chance of remaining any viruses. So this is how to clean a mask. Now let us see a video on how to properly wear a face mask so that it becomes effective.
Wearing a
for
face mask
corona
can help
prevention.
protect against viruses, but it's important to know how to properly wear one. Before putting the mask on, start by washing your hands for at least 20 seconds with soap and water, or use hand sanitizer. Time to put on the mask. Make sure you have the mask right side up. Many masks have a stiff, bendable edge at the top that can be curved to contour your nose. Now, holding the mask by the straps, lift it to your face and bring the straps around either your ears or the back of your head, depending on the type of mask. If your mask has a bendable top edge, go ahead and pinch it now to contour it to your nose. The mask should fit from above the tip of your nose to just below your chin. While wearing, avoid touching your face or mask with your hands so that you don't contaminate anything, and do not lower the mask below your nose or mouth. To properly remove the mask, once again wash or sanitize your hands. Then, holding the mask by the straps, pull it away from your face. Do not touch the external surface of the mask as it may be contaminated. Single-use masks should be thrown away, while reusable masks should be washed immediately. Lastly, wash those hands one more time. Follow these tips to make your mask as effective as possible.
So friends, this video was very interesting, which tells how to correctly wear a mask and wash it properly so as to prevent the danger of coronavirus. So now let us see how to prevent COVID-19 at your home. So here are some tips for preventing COVID-19 at home. First important tip is, which we have already discussed, that wash your hands often with soap and clean water for at least 20 seconds. Make a habit of wearing a mask. Routinely clean and disinfect your mobile phones, remote controls, switches, doorknobs, tabletops, and other frequently touched items. Thoroughly clean the vegetables, fruits, and other home supplies before taking into use. Avoid purchasing food items which are sold open, as they may have contacted coronavirus due to unprotected handling and storage. You never know who has handled the food item. Maybe it may be handled by a person who may be infected by coronavirus. So avoid purchasing open food items as they may have contacted coronavirus. Even if you purchase it, you should properly cook it and only then you should use it. And when using any disinfectant or sanitizer, now there are so many sanitizers and disinfectants are available in market. So you, while using them, check if it is a genuine product, means whether it is produced by a licensed manufacturer, and if it is a genuine product, then follow the direction for users given on the labeling information on the product. You should also maintain general hygiene of your home and premises. This is very important for all the times, particularly at the time of this COVID-19 disease. Continuing the measures for preventing COVID-19 at home, the next step is you should not allow unknown visitors like courier boys to enter into your premises. If they come, talk with them from a distance of at least 2 meters or 6 feet. Ask delivery people to leave parcel or courier at your main entrance. Do not allow them to enter into your home. After receiving the parcel or courier, allow it to for some hours if possible, and then put outer package in trash and sanitize the item before taking it to use. Sanitize it also, but at least you should throw away the outer package in the trash. So because the outer package is the most contaminated, take healthy diet and do some exercises. Are found in any of the family member, immediately isolate him or her and seek assistance from your health service provider or doctor regarding the test and care to be taken for further spread of the disease. So having seen the measures to prevent COVID-19 at home, let us now see the measures for preventing COVID-19 at workplace. Let us see the measures for preventing COVID at workplace. First of all, prepare for the COVID threat. Then assess the risk. Then establish and implement controls. Then take preventive measures. Mitigate the threat by curtailing operations or activities or events of your organization or workplace. Implement business continuity plan so that business is not disrupted. Consider impact of health and safety team in the risk assessment. Often, big organizations have occupational health and safety team at premises, so involve the health and safety team members in the risk assessment process for COVID-19. And smaller organizations should take a support of an OHS consultant from outside. So in this way, you can assess the risk at your workplaces. So risk can be of three types: low risk, medium risk, and high risk. Low risk means workers whose jobs does not require frequent or close contact with the general public, other co-worker, or other have low risk of exposure. So examples of low risk are back office workers, workers providing teleservices, those people who are working from home. So they are at low risk of contacting COVID disease. Now let us see who are at medium risk. There are two categories of workers who are considered to have medium risk of COVID exposure. First is workers having frequent and close contact with the people in high population density work environments, for example, food markets, bus stations, public transport, and other work activities where physical distancing of at least 1 meter, even 1 meter may be difficult at these places. So these are at medium risk, and the workers whose job require close contact or frequent contact between co-workers, including frequent contact with people returning from areas with community transmission. For example, frontline workers, those working in retail, home deliveries, accommodation, construction, security persons, public transport persons, and water and sanitation employees. So these workers are also at medium risk. In the high risk category comes the workers at hospitals or COVID care centers who come in close contact with COVID-19 patients. These are the most vulnerable people. They include doctors, nursing staff, sanitation workers, ambulance drivers, etc. Other workers who come in contact with people who may be more likely to have COVID-19, for example, workers providing domestic services or home care for people with COVID-19, they are also at high risk. And workers who regularly come in contact with objects and surfaces possibly contaminated with the virus. For example, domestic workers, social care workers, personal transport and home delivery providers, and home repair technicians such as plumbers or electricians who may come in direct contact with the contaminated surfaces. So all these people are high risk. Let us see how to establish and implement control at workplaces. Here you can see the hierarchy of control at workplaces. So coronavirus is basically a biological hazard, and therefore for protecting workers, their health and ensuring their safety, organizations should establish appropriate controls. This is very important for all organizations today, and the hierarchy of control in order of effectiveness is shown here. At the top comes number one is elimination. Here it means physically removing coronavirus immediately by hand washing or spraying disinfectants or fumigation, etc. At second level comes substitution. It means replacing the hazard. You can replace existing processes or practices with safer practices where there are less chances of contracting the COVID-19. Then at third place comes engineering control. It involves protecting people from COVID hazard by using appropriate techniques like proper ventilation, use of plastic shields, negative pressure isolation rooms, HEPA filtration, etc. These all comes under engineering control for COVID-19 prevention. Then comes administrative control. and it involves change in work policy of the organization and the workplace and the way of working. For example, minimizing physical meeting, work from home policy, leave for sick workers, limiting exposure of workers from themselves as well as to customers or clients, restriction on visitors inside the workplace, placing symbols or signage for social distancing, workers training and drill to prevent the COVID-19. This comes under administrative control, and the use of PPE is the fifth control. It involves protecting workers with the use of appropriate PPE, means personal protective equipment like masks, face shield, gloves, gown, respirators, etc. And this is a must for high risk workers or those involved in processes having high risk of catching coronavirus contamination. The processes such as those in food industries are very highly risky to contact infection of this coronavirus. So the PPE becomes very important in such processes. So having seen the hierarchy of controls at workplace, let us see some key measures for COVID protection at workplace. So the key measures are: number one, maintaining safe distance between co-workers and customers where applicable. Number two, frequent hand washing or disinfection with alcohol-based hand sanitizer. The hand sanitizer should have minimum 70% alcohol content according to experts. Number three, mandatory wearing of masks throughout working hours where distancing is not possible. Number four, regular environmental cleaning and disinfection. For this, spraying disinfectants or fumigation, etc. should be done. The next key measure is limiting or minimizing unnecessary travel where traveling can be avoided. It should be avoided at any cost. And the organization should make clear policies and messages, provide training and education for staff and managers to increase awareness of COVID-19. So these are the key measures for COVID protection at workplace. Here you can see maintaining social distance, how to maintain social distancing at workplace. In the office work, you can maintain social distancing by rearranging the desks and chairs so that minimum 6 feet distance between two employees is maintained. Here you can see how to maintain social distancing if in the organizations or workplaces where workers come in close contact with customers or clients, for example, in banks or other places where customers come. So maintain distance, safe distance between customers and your employees. So maintaining social distance at workplace is very important. So let us see a video on how to maintain social distancing at
before the arrival of
workplace.
COVID-19. After easing lockdown, governments around the world still require their citizens in their countries to maintain basic physical distancing rules for everyone's safety and to prevent another wave of infections. But how can social distancing still be maintained after lockdown in different places and environments? Here are some recommendations you might like to consider when you are at your workplace. When you go back to work, try and adjust your start time so that you can start work when there are fewer people in the office or workplace. When you arrive at work, wash your hands with soap for 20 seconds. Do not shake hands with your colleagues. Instead, opt for a non-contact gesture, such as a thumbs up. Try to maintain 2 meters distance at all times with your colleagues. If this is not possible due to the type of work you do, then your employer should have in place extra safety measures to maintain your safety. For example, if you work in a factory, you might be given PPE to protect yourself further. Try not to open or close doors directly with your hands. For example, wear gloves or use your arm to push open the door. Make it a habit to clean your work area and desk, telephone, computer and mouse and keyboard with antibacterial or alcohol wipes on a daily basis before you sit down to start work. Any fabric office chairs can be disinfected with upholstery antibacterial spray. Consider wearing a mask and gloves if you feel necessary. If your job is customer facing, then it is advised that you wear gloves at all times and disinfect your gloves after every customer interaction. If your job involves preparing food for customers, then wear a mask as well as gloves. If you use the office kitchen or any other communal area for lunch or coffee, you should try and observe a 2-meter distance rule. When you have finished your lunch or coffee, make sure you wash up your items and utensils with soap and water and clean any surfaces you used before you leave. Try and keep your tea/coffee mug with you after washing at your desk so you can keep using the same one. Do not share stationery with colleagues and disinfect your pens or pencils daily if possible. When using the toilets, disinfect the taps and toilet seat before use. If possible, try and work some days from home as this will reduce your exposure to a busy workplace. After work, wash your work clothes daily using laundry disinfectant and detergent.
So friends, in this video, we have seen how in different settings in different workplaces, how we can maintain safe physical distancing so as to prevent COVID-19 spread. So for various types of workplaces, we have seen in this video how social distancing can be maintained. Now let us see the management of workers with COVID-19 symptoms. How to manage if someone is now infected with COVID-19 and symptoms of COVID-19. Workers are unwell or they develop COVID-19 symptoms or they come in close contact with corona positive person, then you should ask them to stay at home, self-isolate at home and contact a medical professional or the local COVID-19 information helpline for advice on testing and referral. So it is responsibility of the management of the workplace to ask the person who has any symptoms of COVID-19 to stay at home and isolate himself or herself and contact a medical professional. So in this way, the workers with COVID-19 symptoms can be managed at workplaces. So here are some additional measures for workplaces. Now we will go through these measures. The first is daily cleaning and disinfection at least 2 times a day of objects and surfaces that are touched regularly. So all shared rooms, surfaces, floors, bathrooms, and changing rooms should be disinfected as we have already seen in the video. Suspending any activity where physical distancing cannot be implemented in full. So you can suspend those activities if physical distancing is not possible. And if suspension of such physical activity is not possible, increase ventilation, implement enhanced regular hand hygiene, and require staff to wear appropriate PPE like face mask, goggles, hand gloves, work cloths, aprons, or gowns. Some additional measures include providing training on the use of PPE effectively, because the new type of PPE are to be worn by workers at the workplace. So they may not, all workers may not be habituated to wearing those PPE. So provide them training on the use of PPE effectively. Also make arrangements at the workplace for changing and washing of work clothes and also removing how PPE where applicable. So these are some additional measures at workplaces which should be taken care by the employer or the management of the organization. And here you can see this is the PPE shown here, the personal protective equipment kit. The entire kit contains several items which include eye goggles, face mask, surgical gloves, suit cover, full body protecting suit or gown with cap attached to it, as well as a disposable bag for disposing all these items after use. So the management should provide all high-risk workers with necessary PPE and also provide the workers effective training on the use of PPE in effective way. So it is the duty of the workplace in charge or the management to provide workers training on the effective use of PPE. So let us see what are the responsibilities of employers. So the summary of responsibilities is that plan and implement measures in consultation with workers or their representatives, establish engineering and administrative controls, provide PPE or special clothing according to the risk assessment, take special measures to protect workers at higher risk of developing severe disease, ensure health and safety and protect livelihood of workers, ensure that any measures for protection and prevention should not involve any expenditure on the part of the workers, means the cost of PPE or sanitizer or anything should not be borne by the workers. The cost should be paid by the employer and not the workers. There should be no social stigma or discrimination at the workplace for any reason. So here social stigma means if someone having COVID symptom is isolated, or then he should not be behaved something different so that he could feel not better. And if COVID-19 is contracted during work or through occupational exposure, consider to compensate as per national or international law. So there should be no discrimination at the workplace. It includes discrimination in access to information about COVID-19 as well as protection from COVID-19, occupational health and service, and mental health and psychosocial support. So all workers should be treated equally, and workers at higher risk of developing severe disease include those who are above 40 years of age or who have underlying medical conditions like some heart problem or lung related disease or respiratory diseases. So special care should be taken to protect workers at higher risk of developing severe diseases. So this is the responsibility of employers in short, and their workers are also responsible to prevent COVID-19. So they should strictly follow the measures for occupational health and safety and COVID-19 prevention and control. The workers should participate in the training on COVID-19 provided by the employer. They must report to the employer, supervisor, or their supervisor for any situation which may present an imminent and serious danger to their life or health. And workers should remove themselves from any work situations that they have reasonable justification to believe presents an imminent and serious risk of contracting COVID-19 or a danger to their life or health. So if they believe that there is some danger to their life or there is high risk of contracting COVID-19, they should remove themselves from the work situation. This is the responsibility of the workers. They should follow all the training on COVID-19 prevention and control, effective use of PPE, as well as government guidelines, etc. And now Finally, let us see some general measures for facing this COVID-19 pandemic. So, first of all, raise awareness of yourself and community on use of masks, social distancing, hand hygiene, etc. because these are key for preventing COVID-19. Number two, ensure social distancing. For ensuring social distancing of at least 6 feet, you should establish barriers or make markings, symbols, etc. at common places where people may gather. Number three, work from home as far as possible. Number four, focus on the most vulnerable. So people above 60 years and below 12 years of age, as well as pregnant women or people having heart problems, diabetes, or respiratory ailments, cancer, or those having compromised immunity are most vulnerable. So focus on them. Get the things you need if you get sick. So don't overstock or hoarding anything at the time of this crisis. Plan what to do when school or daycares are closed. At the time of this COVID-19 disease, most of the places, schools and daycares have been closed by the government authorities. So you have to plan what to do in such situations. So better arrange for online education for your children so that they can cope up with this situation. Also keep yourself fit both physically and mentally. Number 8, businesses should work on business continuity plans so as to minimize the disruption of business, and government and health agencies should further strengthen health services to meet the COVID challenge and streamline all other necessary services. So these are some general measures for all of us for facing COVID-19. And now let us see a video on how to make your workplace clean and hygienic. So friends, this video makes all the points clear for the prevention of COVID-19 disease, the steps and measures that you should take at your workplace to make it clean and hygienic so as to prevent COVID-19 disease. So this video was very helpful for all of us, particularly those who are working at workplaces. So finally, be prepared for preventing COVID-19 from your community and workplace. You should wash your hands, use sanitizers before entering at workplaces, wear face masks, and maintain social distancing. This is the key formula. So be prepared and prevent the disease from spreading in your community or workplace. Thank you.